I used to go to the nurse's place and sleep for about 3 days. So I'm missing classes, missing a lot of the learning just because of cramps.
So just to mention, what is endometriosis is when you have tissue similar to the tissue which are found inside the uterus, outside the uterus. It can affect the intestines close to the uterus, so mostly the rectum. It can affect the tubes that carry urine from the kidneys to the bladder.
Life 360. Hello guys, my name is Robbie Omondi. Welcome back to Life 360. Now today I'm privileged to be at Third Park Hospital where 12 patients are going to receive surgery for endometriosis. We all know that very many women are quiet most of the time when they're going through pain during their periods. However, pain should not be normalized. So we'll be here talking to patients and also experts to take us through what is endometriosis and what does it mean for a patient to receive an endometriosis surgery and even recover from this particular endometriosis.
Thank you so much, Robbie, for having me. It's such a great pleasure and an honor for me to be part of your show. I think we are talking about a subject that has become very dear to my heart. Yes. And the reason for it is because every woman should be subjected to a good quality of life, I should say, all of us, basically. Now, just to introduce what endometriosis is, I just want to give a little bit of a description what exactly happens. So the uterus has different layers. You have the middle layer, you have the inner layer and the outside layer. Just think of it as different layers. So when a woman is having menses, you have the inner layer which thickens, preparing the uterus in case a woman gets pregnant for the implantation of the fertilized egg. But in circumstances where the woman has not gotten pregnant, that inner layer is going to shed off. And it comes of what we call in forms of blood clots, whatever you want to think of it. Yes. So this inner layer is called the endometrium. You don't have to remember the name, but now when we have tissue which are similar to the endometrium or the inner lining of the uterus, now that is considered as endometriosis. So just to mention, what is endometriosis is when you have tissue similar to the tissue which are found inside the uterus, outside the uterus. Now I gotta be very clear because some will say is the tissue which are inside, they are found outside. Now we've actually found out that these tissues, they are similar, but they have a little bit of differences, and that's what qualifies them to be endometriosis, basically.
So when we speak about endometriosis, sometimes people have pain. The levels is what differs. When I have pain during my periods, should I assume it's endometriosis, or what are the symptoms for endometriosis for someone who wants to understand it better?
Well, I would say that just to clarify this, because there are different stages of endometriosis you've mentioned, very right. But it does not necessarily mean that the level of pain determines the stage of the disease. Absolutely not. So someone can have stage 1 with crazy excruciating pain. And the patient can have stage 4 of endometriosis, but they have these very subtle symptoms, basically. Now, when we talk about endometriosis symptoms, two things we have to talk about, which you've mentioned, pain and infertility. So those two kind of work together. So when you have advanced disease of endometriosis, there could be chances that you could suffer from infertility. So mostly patients are going to present with symptoms around pain. So it's pain during sexual intercourse, pain during menses, pain sometimes during passing stool. Patient will have this generalized, fatigue. They're always feeling tired. We are seeing a lot of mental health that is associated with endometriosis. Endometriosis can be mistaken for other conditions that will present more like the same, like intestinal symptoms, diarrhea, vomiting, constipation, and so on. So we really still don't have classical symptoms that you can say that this is endometriosis. But it has these classical symptoms that would be suggestive of endometriosis. And one of them is pain during menses. So what does that therefore mean? And you ask me, is that if a woman has pain that is making you skip work, that making you dread the next menses, that making you, you gotta have a packet of painkillers, that, the pain is getting worse over the years, then you might want to think of endometriosis. So it's good for you to seek care or consultation from somebody who really understands endometriosis or an endometriosis specialist.
Yeah. So, Dr. Njagi, we are here while the surgeries are going on, and maybe I'll share some bits of what is happening for the surgeries. What does an endometriosis surgery entail for a patient who walks in? I understand that the endometriosis affects different women differently. What does that mean? There are others who are affected to the kidney, other parts of the internal organs. What does that mean, and what kind of patients do you have today?
So it's what we say, the stages of endometriosis. You can have stage 1. So stage 1, you have very small, tiny growths, or we call them lesion or nodules, and this can be behind the uterus. But as time does go by, these diseases can keep progressing over years. And what we'll find is that you can have now a nodule or a lesion or a growth which was about 5 millimeters, now growing to about 3, 4, 5, 6, 7 centimeters, and it keeps spreading because all this is contained in one package, which is the abdomen. Some call it stomach. So the disease can actually, we found endometriosis quite notorious in terms of how it can spread. So it can be around behind the uterus, it can affect the intestines close to the uterus, so mostly the rectum. It can affect the tubes that carry urine from the kidneys to the bladder, which is called the ureter. It can invade the nerves. Well, it can actually also rarely found in the kidneys, not been very much, but we found that kidneys can be affected from the compression of these ureters, the tube that carry urine from the kidneys to the bladder. The endometriosis, again, it can spread to the diaphragm. It can actually get into the chest, into the lungs, and so on. So we found endometriosis in different places, and this would basically mean that it has a tendency to be found at, almost every possible organ. But commonly, what we find is a pelvic endometriosis or endometriosis around the uterus.
Does this mean through these surgeries, endometriosis can be treated? And for a woman who maybe has had issues conceiving, does it mean after the treatment they can conceive and go back to their normal lives, live pain-free and such things?
Absolutely, that's our intention. But being honest with each other, from what I've explained, is that endometriosis can be quite aggressive. So usually, our objective is to try and improve the quality of life or improve fertility if possible. But then again, remember that the tissues can be affected, especially infertility, can be affected to a point whereby reversing or taking them back to their normal state might be almost impossible. But we had patients who have endometriosis, treat them, then they can conceive? Absolutely, yes. So it just depends on how bad the disease is. Do you have patients that we treat and then they can have pain-free life? Oh, absolutely, yes. But remember, this is not curative. This is management. So cure for endometriosis, we still don't have cure for endometriosis. So if we can give a patient a good quality of life for God knows how long, then I think that will be pretty good for the patient.
This means this is good news for at least 12 patients who have visited Third Park Hospital. For the next 3 days, the surgeries will be going on. Is this something that happens frequently? And for someone who would like to, get this kind of services, how do they go about that?
Oh yeah, I should say that the patient that we're having during this workshop or this endometriosis surgical marathon is patients who have advanced disease, so stage 4 involving bowel and advanced disease. So we've had patients, the first 2 cases, a patient who have disease involving the rectum. So it's our conviction that after treatment, patient will definitely get better. That is our conviction. If you ask how often we do the endometriosis marathon, I mean, it's a marathon. It's just like asking how often do we have the, whatever marathon. It's just once in a while. Because doing 12 surgeries for endometriosis in 3 days is quite exhausting, because this surgery can even go sometimes up to 7 hours, and we have to be very aware that it can be complex. So the advantage with this, we are almost 6-7 of us endometriosis excision surgeons. So we are able to kind of, you do one case, take a break, then somebody else does another case. So there's continued care. But if you ask me doing 3 cases of endometriosis in a single day, that might be quite a toil on, especially for these kind of cases that we are operating now, which are stage 4 endometriosis. In terms of cost for endometriosis treatment, can be quite expensive, and this is a bit of the limitation that we have, and usually it's because of the equipment that we have to use, the instruments that we have to use. It's how we get them from the supplier. So especially for the intestines, if you have an equipment that will cost you more than 100,000 just to only take care of the intestine, you've not talked about everything else. So you can find that the cost of the consumable, or the instrument that we are going to use, is going to more than 200, 300,000. So if you include theater time, medications, and so on, you can do the math and imagine how much the bill could get to.
Yeah,
so.
I understand that on average, surgery for endometriosis could cost up to 1.5 million or even more. But now with such instances, when you have the surgery marathon, the price is subsidized. However, if a patient, for instance, has a cover, let's say an HIF cover, does that cover to some cost, to some extent? Because many patients will stay at home because of lack of funds to seek for this kind of treatment.
Oh, absolutely. I think you're right. So these costs are subsidized now, because let's say, for instance, we are not taking professional fee, so you're not going to charge what a doctor will take as a doctor's fee. We have companies which coming in and supporting us, and either giving subsidized cost for the equipment and some donations. So we make the cost for this workshop quite affordable. But absolutely, I think you're right. You've mentioned about insurances, and I think we need advocacy, because you find that some insurances, they don't approve for certain equipment that are needed for endometriosis. Some decline to pay for endometriosis, calling it a chronic condition. So we are really having a lot of challenges in terms of coverage with insurances. So I think a good conversation and with insurances, because if you think about it, this is one disease that is affecting one woman out of every 10 women are affected with endometriosis. So endometriosis is more common than diabetes, if you come to think of it. So we need to have conversations, and honest conversation, in terms of coverage for the treatment. And HIF, honestly, don't get me started with it, because I've seen the much they cover for condition like endometriosis is 80,000. So
That can barely pay for the equipment that we're talking about.
Well, if there's bowel endometriosis, you cannot even pay for a single equipment for bowel endometriosis, leave alone theater time and so on. So maybe government need also to invest on management of endometriosis and equip hospitals and train skilled endometriosis specialists, because it actually needs a lot of training, and it's a really a lot of skill for you to become an endometriosis excision specialist.
Yeah, so guys, as Dr. Njagi has mentioned, it has been 3 days of surgeries done to 12 patients here at Third Park Hospital. I believe it would be nice to speak to a patient, or rather someone who has gone through this journey of endometriosis and now has been here for the past 3 days. She did her surgery 2 days ago, and now her journey to recovery begins. Allow me to speak to Judy Murioki, who will take us through her journey through endometriosis, from the time she began her periods until the time she discovered she had endometriosis, and now to a time when she has undergone surgery. Welcome, Judy. Thank you for speaking to us. Maybe just introduce yourself and take us through your journey with endometriosis.
Okay, my name is Judy Murioki, and I've just had surgery for endometriosis. I don't know anything like simple periods. They have always been difficult from the very first time I started them in high school. I used to go to the nurse's place and sleep for about 3 days. So I'm missing classes, missing a lot of the learning just because of cramps. And every doctor I used to go to was saying, this is normal, just painkillers, all other women go through this. Just take painkillers and you'll be okay. So when 2010 is when I found a doctor who told me this is not normal. And he walked me through the journey. He told me that is not normal. You're not supposed to be in this much pain. You're not supposed to be missing work. Yeah, I'm supposed to, it's not supposed to be this bad. So we're going to find out what this is, and then we'll deal with it from there. So at that point, he diagnosed me with adenomyosis and fibroids. And he put me on medication to suppress the symptoms. And 2019 is when I did the surgery to remove the fibroids. And about 6 months later, the fibroids grew back, but the pain was worse than it was before. So now we were looking for other doctors, and that's how I got to find out about Dr. Yamal. And there's even an endometriosis foundation group. So that is how I came to know even in everything about this endometriosis marathon, surgical marathon.
So maybe just to put context, when did your periods begin? And probably you had girls around you who did not have painful periods. How did that make you feel?
They started when I was in Form 1. And I can remember it's only two girls. We were only two who were always, every month, going to the nurse. Every month, going to the nurse. Yeah.
So eventually, when did you discover that you had endometriosis, and how has the journey been since the discovery?
So endometriosis, I knew about it 2020 actually. Yeah, because I'd had the surgery in 2019 before. So now when they were doing imaging for just checking what's happening, that's when they discovered endometriosis. So from there, I've gone to several doctors. Yes, they're confirming, yes, this is endometriosis, but we need to go in there to find out if it is. So and I was not comfortable with that. So that's when I found Dr. Yamal. He said, when he did the imaging, he showed me, this is it. Yeah, and then now I've been walking the journey with him since then.
And for maybe what you've discovered, endometriosis also affects probably some of the internal organs. Has that been the case for you even as you went through the surgery? Did the endometriosis affect some of the internal organs?
So for me, other than the pelvic region, it affected my bowel, and it was I was getting shooting pains down my legs. So that's the sciatic nerve. Yeah, and lower back pain. I was getting migraines pretty much every day. Yeah, those are the main symptoms I was having.
When you say that every day you had pain, were these the days that you had your periods?
Even without my period, I could be having headaches, I could be having the leg pain, I could be having the back pain. Only when I have the period is when I feel like lower cramps. Yeah.
Now, going through the process of preparing you for surgery, how did it make you feel that after the surgery you could possibly have pain-free periods and eventually a pain-free life?
That is what I was looking for, because it kind of put a full stop on my life. Even work, I was not working. Going for social gatherings, I was not going for them. Even traveling in a car just within Nairobi, it was difficult. I have to sit on a pillow because every slight pothole or bump, I feel like a pain shooting up.
So far it has been 2 days after your surgery, let's say about 48 hours after your surgery. How does it feel, and how have you prepared yourself for the healing process?
It's so much better today. I'm able to walk on my own. Bit TMI. I'm able to make bowel movements. And yeah, that is great progress, apparently, from what everyone is saying.
Now, if you let me ask maybe a little bit of a personal question about motherhood, how has that ever occurred to you? Because most people feel when you have such conditions, it's going to affect possibly your fertility. Has that ever come to mind, and how do you feel about it?
This pain, it just took up as it covered my whole life. So it wasn't even something that was in my mind, that becoming a mother.
How about now?
Well, I can't, because I had a hysterectomy.
Okay.
Yeah.
Now, for any young girl out there maybe who has painful periods and they've been made to believe that during their periods pain is normal, what would you tell them now that you've gone through that journey and you understand what pain during periods mean?
Pain is not normal. Even a little pain is not normal. Go get checked out. There are doctors nowadays who are trained to detect these things. And if they can't detect it, they're going to refer you to somebody who is able to do it.
Thank you very much, Judy, for sharing your story and your journey. And definitely, we wish you a quick recovery. And maybe for those who have listened to you and have listened to the doctor, they'll take a step when they feel their periods is a little bit painful. Thank you very much. And to you, my viewer, I appreciate for sticking along with us up to this end. I believe you've learned something about endometriosis. If you have painful periods, don't just sit and wait for a time when endometriosis or fibroids could have gone to a different stage where it will be difficult to get assistance. Get checked. Time to time, we're told women should have maybe checked up or go for checkup regularly to ensure that even their reproductive health is on point. Up to this end, my name is Robbie Omondi. This is Life 360. Stick around for more of such interviews and many insightful interviews that we'll be doing on this show. Feel free to subscribe, share, comment below. It will go a long way in ensuring that we do a good job in creating awareness on matters health. Until next time, bye-bye.